Hi, I'm Rebecca.
I'm Monique.
I'm Kaylee.
And I'm Steph. And our proposal is for bone glue infused with osteoblasts. Each year in the United States, over 400,000 sternotomies are performed for open heart surgeries. The sternum or breastbone connects the ribs to form the rib cage, which protects the heart and lungs from injury. The sternotomy procedure requires the surgeon to make an incision in the sternum and then crack the sternum in half in order to access the heart or lungs. Surgeries requiring sternotomies can range from heart valve repairs to heart transplants. These procedures can range anywhere from $25,000 to $200,000. Following completion of the heart or lung surgery, the sternum must be rejoined and repaired prior to closure. Current closure methods can result in pain, infection, or even death.
Our plan is to develop a glue for surgical purposes. Our plan is to use PPF and HA as the components in our glue. PPF has a modulus between 10 and 100 megapascals, and HA has regenerative properties. Together, these will help with cell adhesion and proliferation. We will then infuse the glue with osteoblasts that will be obtained from a cell bank. These osteoblasts help with bone growth and therefore will help with the healing process. The glue will be applied to either side of the sternum, and the sternum will then be held together long enough for the glue to set. Once the glue is set, the surgeon can continue closing up the body and complete the surgery. The glue itself will work as a scaffold in that the bone can grow through the glue and hopefully cause the healing to happen faster. The glue itself will degrade over time so that by the time the entire sternum is healed, there will be nothing there and the patient will not even realize they had a sternotomy.
We believe that our bone glue is a cost-effective option that will improve surgical results. Using the bone glue will lessen the complication of the surgery and eliminate any need to remove hardware. Along with the simpler procedure, the presence of osteoblasts can reduce post-operative healing time, allowing the patient to return to work and save on medical expenses. Many sternotomy patients complain of feeling their hardware post-operatively, but with bone glue's degradation properties, it will improve patient comfort down the road. Because this is a relatively new field, bone glue may require additional expertise. Harvesting cells poses challenges as it requires advanced preparation and planning for the cell material. The bone glue will need to satisfy many legal and technical requirements, especially with the infusion of osteoblasts. Clinicians will need to collaborate with cell and tissue banks for the necessary resources and legal handling of the cells. And finally, bone glue will probably be more expensive than the traditional technology because of the additional cell resources and companies involved. But as we said, it may cut down on hospital stay and reduce rehabilitation needs, as well as improve overall patient satisfaction. Additionally, there is a huge market for this technology, both in sternotomies and other orthopedic applications. Once it becomes commercially available, we believe it will be readily adopted by the medical community over the current technology.
So as previously mentioned, there are currently two main solutions that are used for sternal repair. These include wire circlage or plates and screws. So while metal wires can be resistant to breakage, they are not a stable closure method. They can result in incomplete healing of the sternum, and they can also protrude and be felt by the patient following surgery. Sternal wiring can also lead to severe sternal wound infection and can require further surgery for rewiring. Plates and screws can be implanted as an alternative and have lower profile than the wires. However, these are susceptible to corrosion and can cause micromotion during healing. The method is slowly being adopted by surgeons due to the more intensive technique that this method requires. The ideal closure method for sternotomy repair should ensure stability, reduce the rate of post-op complications and infection, and also allow for a shorter period of hospitalization. Our proposed osteoblast-infused bone glue for sternotomy repair will allow for this and will provide the patient comfort during and after the healing period. Thank you.